Dr. Jake here for Northwest Healthcare Center. Today I'm going to talk about the clam exercise, and this is specifically more for someone who has a sacroiliac or SI joint dysfunction, or even if you're having like hip imbalance around here muscle-wise. Like even if people have IT band issues, strengthening your glute medius is what we're trying to activate with. It's a goal of the clam exercise. People ask like, well, does it treat sciatica? Indirectly it could. From if we're getting the right muscle activated in your glute, it can take load away from the nerve, the sciatic nerve that could be going down your leg. So I have definitely seen it help people with sciatica, but depending on where that sciatica is coming from, if it's coming from muscles deep in here, the piriformis, or if it's coming from your back, it's probably not going to help it then. But I'll show you the clam exercise here just to make sure, because it's going to be, I want it to be specific. So first thing, you always want to start with the side that bothers you or that's the hardest to perform first. So for the sake of me showing you, I'm going to be up like this, but when you do it, you can actually be down like this or like this. But like I said, for me just making sure the setup is right, the first thing is the angle of the knee. So I don't want you like this. I don't want you straight. You kind of split the difference. So about there. So just past 90 degrees. After that, you want to make sure you line up your ankle, hip, and shoulder. And I know I'm pointing to this shoulder, but a lot of times I'm telling people to bring their bottom shoulder back to get them lined up. How I tell people to make sure that they're lined up right is come up like this, rest your elbow right on your hip, kind of intersect your ankle with your fingers like that. I know I'm pretty good there. Then I go down. From here, you're gonna clam, so you guys can figure out what I'm gonna do. You go up as high as you can go without rolling back. So you wanna keep your back square here. So this is what it looks like. Think up 1, down 1, 2, 3. And what that's doing is activating your glute medius, which helps stabilize your SI joint better. And it's a more efficient, bigger muscle than the deep piriformis muscle in there, or even your IT band or the TFL muscle in around your hip. So I'll show it one more time here. So think up, 3 count on the way down, nice and controlled. And it might be a little shaky at first, a little ratchety. That will get better as it activates more. So like I said, I usually say 2 sets, 8 to 10 reps twice a day, but you always want to match sides. So if I'm doing this side and I'm doing it, I get to number 7 and I start reproducing some pain, I stop, switch, and do 7 on my other side. So that's the clam exercise, and that's to mainly help to activate your glute medius to help with SI joint dysfunction.